Orthodontic appliances look complicated until you know this. They all do only 3 jobs: expand, move teeth, or anchor. Once you know the job, the design starts to make sense. In this quick guide, I'll break down the most common appliances, which are Hyrax, MARPE, springs, and tates. For each one, I'll tell you what it does, where it sits, and when it's typically used. Expansion appliances. First, Hyrax, also called RPE, Rapid Palatal Expander. It is a fixed expander on the upper molars with a central screw in the palate. When the screw is activated, it widens the upper arch, commonly used for a narrow maxilla and posterior crossbite, especially in growing patients. On screen, the key is the screw, that is the engine. Next, Quad Helix, a wire-based expander that delivers light continuous forces, good for gentle expansion and helps control molar rotation. Think slow and steady expansion. Now, MARPE, mini screw assisted expansion. It adds mini screws in the palate for a more skeletal effect, often considered in older teens and some adults. Notice the mini screws, that's what makes it different from classic RPE. And SARPE, a surgically assisted expansion, typically for adults when orthodontic expansion alone is not enough. A combined orthosurgical approach. Removable appliances. The acrylic base plate is the foundation. It supports the appliance and provides stability for springs and bows. Adam's clasp is for retention on molars. It keeps the plate secure so the active parts can work properly. Labial paw sits across the front teeth for control and retention of the interior segment. Z-spring pushes a single incisor forward, classic for interior crossbite correction. T-spring is for targeted tooth movement, sometimes localized expansion depending on design. Finger spring moves one tooth with light controlled tipping. Buccal canine retractor helps retract the canine. It needs strong anchorage. Always ask, where is the anchorage coming from? Anchorage appliances. Temporary anchorage devices. Give a stable anchor point so you can do movements that are hard with teeth alone. Remember, anchor from bone, not from teeth. TPA, transpalatal arch, connects upper molars to control rotation and maintain transverse stability. Lingual arch, helps with space maintenance and anchorage in the lower arch. Nance, reinforces upper anchorage using an acrylic button on the palate. And that's the quick guide. If it helped, hit like and subscribe. Comment which appliance you want next: Hyrax, MARPE, springs, or tates. And I'll make a focused video with clear examples.